2, 1.
Hey, everybody. Good morning. Thank you so much for joining us. This is Harriet Kimmick with Down to Earth, and it's the show in which we talk about the issues that matter. So, thank you so much for joining me this morning and for putting yourself in a position where you'll be able to hear from us and what we have to say. It's kind of like one of those things where we literally talk about what matters. So, for those of you who are interested in taking a break from the conversation surrounding the political spectacle that Washington has become, thank you for joining us. I don't want to hear it. I've heard enough. And it is football season. And frankly, I just want to focus on fall and football season, although it doesn't feel like fall in my neck of the woods. It's more like winter. So we're having full-fledged winter. I mean, fall was like, hey, what's up? Bye. And we're in full-fledged winter mode. I mean, we have snow on the ground, we have ice, we have black ice, we have wind chills, and so we're in full-fledged winter mode. So for those of us who don't have the luxury of being on TV all day long and getting a chance to talk to people, this is real life for us. For us, real life out here is not living or working in a 20-story on the 25th floor. Real life is right here dealing with the stuff that makes up real life, right? So I want to thank you for joining us and to continue to support our show. Thank you. We are seeing people who are interested in our show, so I want to thank you. And if you haven't done so already, I'd like you to download and subscribe to our podcast. It's Down to Earth. There are a variety of ways that you can listen to us, obviously. One of which is through this medium, Blog Talk Radio, Anchor FM, right? As well as Spotify, Apple Podcasts, Google Podcasts. Those are just some of the ways in which you can continue to listen to our show. So thank you so very much. And as you can see, as you go through our show, once you click on subscribe, it will notify you when a show becomes available, when a new show becomes available. And if you miss a show or you perhaps just join us for 5 minutes, but while you're driving around in today's cars, right, the technology is such that you can literally just join us wherever you're joining us from. So it doesn't have to be, uh, you sitting in front of your laptop or your phone all day. You can actually connect your phone to your car and you can go into Google Podcasts or Apple Podcasts and you'll be able to hear us as well. So thank you so much for joining us, right? I'm a little distracted, right? I thought they're moving things around here. Anyway, because they just stopped. But thanks so much. So today we're going to shift it a little bit and talk about the infant mortality rate, maternal mortality rate, I think is the best way to describe it. And we're talking about why are women dying in childbirth in this country. Especially we're seeing an alarming number of women of color, particularly Black women, who are dying in childbirth. And it is of concern because it's happening right across the spectrum. You would have thought that this was confined to certain socioeconomic classes, but what we're finding is that it's happening everywhere. It's happening to all women. Recently, Serena Williams gave her story. Morning, how are you? Serena Williams gave her story, Grand Rising. Thank you. Honored, right? Uh, Gave her story on how she was actually in the hospital, had given birth, and developed what is called a pulmonary embolism, something that is a prior existing condition in her body and that she's familiar with. And when she tried to get the attention of the medical staff, they ignored her for an entire 24-hour period in which she could have died. Right? So I want to talk about why are women dying in childbirth. This shouldn't happen. You would have thought this was something that our grandmother's generation grew up with, right? Perhaps to a lesser extent our mother's generation, but it shouldn't be happening in our generation. right? Because the advancement in medicine and technology is such that it shouldn't happen. I mean, just yesterday, I was at a forum at Oakland University. My daughter, my youngest daughter, is going to be a pre-doctoral student next fall at Oakland University. That's what they call them when they're going. They're not pre-med. Once they actually have started the semester, they refer to them as pre-doctoral student. And she was really when I listened to a lot of the presentations and the advancement in medicine and the ways in which people think about medicine now has completely revolutionized. They now use robots to perform surgeries. Did you know that? In a lot of cases, hospitals are using robots. So the robot is programmed to perform the surgery, and the doctors are standing and watching the robot perform the surgery. I don't know if that means at some point, like if you come in through an emergency room, that kind of thing, if there's an accident or a shooting and people go into emergency rooms, if that is what they will do, if they will use robots. But they do use robots to perform routine surgeries that are recommended, surgeries that have been scheduled. So, in the case of the one scenario that I heard about was hysterectomy. A hysterectomy is the removal of a woman's uterus, whatever time that happens or whatever, right? And it was about a few years ago, I went to a healthcare forum and they showed me the video of what it looked like when the robot was performing the surgery. There was one robot in there. The patient was completely asleep, was completely knocked out, and the patient was prepped, and the robot performed the surgery, and the doctors were all standing behind the view, behind the screen, watching the robot perform the surgery. Now, I don't know what that means for medicine. If that is something that means we will need less doctors, it seems to me that if we can use robots to do anything, I guess robots will soon be delivering babies, or robots will be having babies. I don't know. I don't know if I'm going to leave my robot, any robot, to take care of a baby of mine any day now. But when you think about it, if we have advanced so much, then why on God's green earth are women dying in childbirth? Seems to me that there are some inherent biases that might be existing within medicine, right? So I decided to explore some of those myself to see how would it affect me. And what I found was that it was not as open as I thought it would be. There are certainly some preconceptions that are mostly confined to people's individual prejudices and biases. You know how we don't realize that we are prejudiced or biased until we're thrown into the situation? And then you realize that you do have some biases. You do have some biases about where people come from. You do have some biases about how people look. You do have some biases about interacting with different people. You don't know that you do, but they're there because it's part of how we're socialized as human beings, right? And so when I decided to look at this, I had to really, really, my friends, look at it. So I threw myself right smack in the midst of it to see what would happen. And one of the things I discovered was that based on who you are and your ethnicity, the medical system treats you appropriately. So if they look at you and you fall based on someone's individual prejudices, you walk into a doctor's office. If you are a person of color, they try to figure out which box do you fit in. So if you look like you're poor, sucks to be you. They're going to treat you really badly, right? It is real, right? And it's usually coming from the staff. But where do the staff absorb these ideas from? They absorb it from the people around them, right? And if you are of a particular ethnicity, they're going to run the gamut of tests on you simply based on what they think your particular ethnicity is predisposed to, whether it's true or not. In my case, because I look black and I guess I sound black and act black, I'm black, I don't know what else they're going to do. They just say, okay, well, your prevailing ethnicity is this. So people of your ethnicity are predisposed to having high blood pressure, diabetes, and so on. And I'm like, stop. First of all, stop. I'm an individual. Stop. Just stop. Do you see what I'm saying? So the second thing, and for a long time, I would go to the doctor and I would just sit there and observe how they're treating me based on their perception of who I am. The other thing that they treat you based on is your insurance. What type of insurance do you have? They look at you and they treat you differently. How much money can they make? You got to understand, they're looking at how sick are you likely to be? So how much money are they going to make off you? So like me, they don't like me too much because they're not making any money. They're not writing prescriptions. I don't have, I don't have what they want to be able to create a case around. But do you see what I'm saying? But at the same time, I am suggesting that everyone needs to be aggressive about your health. Ask questions. Do not be intimidated by the medical profession. When you go to the doctor, ask questions of the doctor, not the office staff. Ask the doctor. Insist and say, "Excuse me, I have some questions about this and that happening in my body. Can you explain it to me?" And if they can't explain it to you, then you need to go find a doctor who can. You call your insurance and say, "This doctor is not responding to my needs." And the insurance will change it. Even if it's not open enrollment, they will review it and they will change it for your next visit. I kid you not, right? Because time is up, y'all. The time is up for you to be treated in a traditional way by a medical system that is still heavily based on prejudices. Right? I found when I went to the forum yesterday that now the way they're admitting students to the medical program has changed. I couldn't believe it. There's the traditional way. Now they want a more holistic approach. They actually refer to it as a holistic approach. They want well-rounded candidates because what they have realized is that the traditional way has excluded perhaps the best candidates. So you end up with people who have no people skills at all. They don't know how to talk to anyone. And they're so inherently biased, they can't even overcome their prejudices and biases to interact with people. The world has changed. We now have something called telemedicine. You know what telemedicine is, right? If you're on Instagram, you find out that you can talk to your therapist any day of the week, anytime you want to. That's telemedicine. Dial up a doctor. And most hospitals now have it so you can interact with a doctor without waiting to see a doctor. So the era of telemedicine has arrived. We foresaw this 10, 15 years ago that this is where it was going to go. And the time has come. So the traditional doctor, the traditional person who thinks I am God and beside me there is no other, and I am the Lord God who's going to tell you what's wrong with you today, that era is gone. But unfortunately, the biases and the implicit biases that created those scenarios and created those individuals, that system is not gone. You see what I mean? So you find then that women are becoming pregnant, and women get pregnant, go to the doctor, and they're complaining, but it's almost as if you're invisible. One of the things that gets me about prejudice and implied and implicit biases is the fact that you're a whole person, but I'm invisible. Nothing offends me like trying to make me think that you don't see me. There's nothing more offensive to me. I am a whole person. Don't pretend I'm not standing in front of you. Don't pretend that I'm not a person and I'm not asking you a question. And yet, that is what is happening to women of color, regardless of their social status, regardless of how good their insurance is. They're still being treated by a medical system as if they don't exist, as if they're invisible. This is why I've been going to the same doctor for 15 years. I'm not changing, because if I go somewhere else and you're not going to listen to me, I'm changing you quicker than I would than a New York minute. I kid you not, because the time is up for that. And I don't have time to teach you any cultural context or any kind of cultural competences. Do you see where I'm coming from? This whole prejudice thing, this whole racial implicit bias thing is so endemic and so integrated into our systems that it's almost like, gosh, you need a coronary to get over this stuff, because it is so endemic and so ingrained in people's thinking, they can't get over it. So you go into the doctor's office, and the people who work for the doctor absorb the implied and implicit biases that suggest that if you're black or you're brown, then something is wrong with you and you should not be touched, and you're not treated with the same level of deference and courtesy. They're not open, they don't talk to you. When you ask questions, they don't want to talk. And I'm like, this is not for me. I'm the kind of person who speaks up. For years, I was going to my primary care, and I just saw how they treated people, but I liked the doctor, right? So after a while, I didn't say anything. But then when I spoke up, you best believe they made changes. You know why? I'm a patient, and I'm a member of the public. You don't want me to go on social media and say bad things about you, so they started listening. I noticed that the staff changed. They changed their attitude. You see what I'm saying? You've got to speak up. So here's a scenario where Black women, educated, right? Financially stable, right? And I don't know since when those things have become a thing, because white women go into doctors' offices, and regardless of their social status, regardless of how much money they have, they're treated with deference, and they're treated as if they're at least a human being. But the implicit biases that exist within medicine dictate that you're a whole person and you don't exist. It's like you're totally invisible. Like, I'm not a person standing in front of you. I'm the kind of person who will say, look here, look at me, right here. Talk to me. I'm standing right here. Right? And sometimes, I've found that sometimes people don't like when, I heard a person say the other day that they don't like when people are direct like that. And I'm like, but you have to be direct, because a whole person is standing in front of you and you're treating them as if they don't exist. You're treating them as if, what happened? So Black women going into the doctor and they're complaining about stuff. You're pregnant. Pregnancy, anybody ever been pregnant? Until a man becomes pregnant, a man will never know what it's like because you guys probably think we just lay down and just make a baby, and then, we don't seem to do anything else. Are you kidding me? Do you know what changes your body goes through? Your whole body changes. Your organs shift as the baby expands. You do realize that within the same body, the heart, the lungs, the kidney, all those organs have to be displaced in order to accommodate the growing baby, right? No wonder women end up with problems afterwards. Like my doctor was explaining, when a woman has a hysterectomy, her bladder that was sitting on top of the uterus just collapses. Where the heck does it go? I kid you not. And this was me, huh? So where does it go? You know what I mean? When she was explaining it, I'm like, so where does it go? Explain. Right? So the changes that a woman goes through, and you go to the doctor and you say, I'm not feeling well, or when I wake up in the morning, I feel dizzy even after morning sickness has passed, or when I eat certain foods. So you've got to listen to what they're saying. They're not listening. It's like you're invisible. I call it the invisible person. You're a whole human being with a whole personhood, a whole life, and yet you are invisible to the medical profession. So they don't see you. So you're complaining. They just have this thing in their head. It's just another Black woman who is pregnant with a Black baby. I kid you not. Any day I come across an attitude like that in any healthcare professional delivering that, man, you're going to see me on the 6 o'clock news. I am going to ream them out. That is the most disgusting. And this is why medicine is changing and the practice of it is changing. Even medical schools are changing whom they're admitting to medical schools, because you're passing people who can pass chemistry and biology, but they suck at being a human being. They have no skills whatsoever to interact with the public. They don't include and inculcate the person's whole being in their medical experience. Look at you and I, for instance. How are you going to separate me from my environment? Do you see what I'm saying? I come as I am, right? I come to you as I am, right? It's come as you are. So then, if you're going to look at me within the context of me being me, that's your responsibility as a medical professional. If there is no other place where it matters, is in the doctor's office. So you're talking to this person. The least you can do is give them 3 to 5 minutes of your damn time to figure out what on earth they're trying to tell you about their body. You know your body. You live in your body 24 hours a day. You can tell your uprising and your downsetting. You can tell if you're going to have a headache. You can tell if I eat that stuff, it's going to make my stomach squeak. So why shouldn't a medical professional give you the courtesy of listening to you instead of making assumptions? This is why I say develop. And some of us will say, well, when I go to the doctor's office, I try to be nice to the people. You can try to be nice all you like, but if they have implicit biases and prejudices, they're still going to mistreat you and not listen to what you're saying. So I am saying find some people who are going to listen and who are credible, right? And competent to act on it. There's such a thing as cultural competency. Anybody knows what that is? This is why you love listening to me, because you learn so much about life. Don't you just love it? Right? I share my knowledge. I share my knowledge with you, right? But cultural competency is an important core characteristic that is necessary for interacting today with anybody. Cultural competency just simply means that you are able to translate someone's culture and you're able to handle people based on who they are, who they is, as they would say, who they are. That's cultural competency. But what they're finding is that a lot of people who, especially the people who graduated medical school and who have been doctors under the traditional system, they lack cultural competency. They don't even try to be empathetic. Empathy, what the hell is that? I listened to a group of medical students last night expound on how important it is to be empathetic and sympathetic. And I was sitting there like, Lord, there is hope. Are they going to graduate any day soon? Right? I was so amazed. I'm like, there is hope after all. Right? And they were expounding on how important it is to be empathetic and sympathetic. Those are two words I've never heard doctors, in my experience, utter in their lives. I used to think they don't have any feeling. You ever wondered about that? Have you ever seen a doctor deliver a life sentence to someone, and the way in which they impart the diagnosis is enough to make you say, boy, I'm sure glad it wasn't me. The way they say it. A few years ago, when my mother was diagnosed with cancer again for the second time, we went to the emergency room because mom probably knew something was wrong, but didn't want us to know, right? So we compelled her to go to the emergency room as a way of getting some sort of a diagnosis so it would trigger the doctor, it would trigger everything else, right? So we convinced her. She wasn't listening to me. I had been saying it for 3 or 4 months. She wasn't listening to me, so she listened to the others, right? So finally, we were at the emergency room. And the minute she went to the emergency room, I didn't take her because she wouldn't go with me. Because she says all she said to them was, she's just going to argue and talk all day. She's just going to tell me what I should and shouldn't do, so don't bring her. So I said, okay. So then they called me and they're like, you are going to come, right? And I'm like, does she want me there? And when I showed up, the doctor, certain things needed to happen. So I'm like, why is mom sitting around here waiting? And the doctor said she needs to do this right away. So then they started acting. But when the doctor came, who had watched her scans, and the radiologist, when he showed up, the way he delivered that death sentence was like he was talking about he's going down to Starbucks to have a cup of coffee. I was like, huh? What do you mean by a mass? I'm like, define the word mass. What do you mean you see a mass? It's either you see it or you don't. What do you mean? How long has it been there? How did it escape you all? And she's been going to the doctor. So explain something to me. And the way in which he imparted it was devoid of empathy for the individual and for the survivors. So I sat there and I looked at him for a long time while he was talking, and I didn't say anything. So I said, would you do me a favor and call her primary care physician and notify him that we're here? I'd really like him to call us tonight and talk to us about this. And that's when he opened his eyes and looked at me. I said, oh, so I exist now. I'm a whole person. And when the physician called, I said, for the life of me, I can't understand why these people are imparting this kind of information like they're not talking about human beings and human life. Do you see what I'm saying? This is the inherent prejudices and biases. And I used to think that it was part of being a physician to not show feeling. No, it wasn't. That's just how some people are. And they just don't know how to say, I'm so sorry, ma'am, or I'm so sorry, sir, this is happening. There are other resources that our facility has. If you need them, please let me know so I can direct other people to come to it. That was one hospital experience. You know how I know that this is based on implicit bias? That hospital sucked. I didn't like the way they were treating mom. So I convinced her, and I said, I want to move you to another hospital. I took her to another hospital for a consult. When I took her to the other hospital, here's how they treated her. Ma'am, so-and-so, this is your daughter. Would you like us to share with her what we have discovered? And mom said, tell her everything. She's the one who needs to know. All of a sudden, no, I went from being the one she didn't want to talk about to the one who needs to know. And I kid you not, the way they explained the process, right? And the treatment and the alternatives and what happens. I was sitting there, tears rolled down my eyes. I'm like, thank you for being a person and treating me and treating mom like she's a person, like she's not just some number on a sheet. And they're like, excuse me, ma'am, is that in your experience? Did this happen to you? And I said, yeah, that's so-and-so and so-and-so. Yeah. And they shook their heads. The chief of surgery shook his head. He said, we've heard that complaint before, but you won't find that in our facility. I'm like, well, that's why you're a winner. And they painstakingly demonstrated empathy and sympathy to the extent where they told me that the way in which you loved your mother and has proven to us, if there was anything we could have done to prolong her life and save her life, we have done everything in our power to do that. Just because you love her and she's important and valuable to you, we don't want to see you hurt, but you do have to go home and prepare your family, right? But do you see what I'm saying? The delivery is everything. The way in which it was delivered, they listened, right? They saw and they listened. This is my mother. I don't want to lose her. She's important to us. She's important to my family. They listened. Do you understand what I'm saying? So many times what is happening is that people are invisible, and the implicit biases and prejudices that exist prevent them from hearing what you have to say. You go to the doctor. You tell the doctor you got a cut on your foot. Yeah, let's just stitch it up and put some thing on it and give you some antibiotics for an infection. They don't hear that, man, I got to go to work tomorrow. I can't stay home. Is there anything else that you can do to stop this bleeding so it won't come back? Before you know it, you end up with another situation and you end up back in an emergency room because you develop an infection because they're not listening. This is why so many Black women are dying in childbirth, because they're not listening. You're not a person. You're not valuable. The society and the inherent prejudices and implicit biases that exist have taught people to be cold, right? If you go in rural America into the Appalachian Mountains where there are poor white people, it's the same darn thing they do to them. They're poor whites. They don't have any value. They smoke meth. They make meth in a trailer park or whatever, right? And so they don't listen to what they have to say. They don't think that they're valuable. Do you see what I'm saying? We got to stop this. And if we, the public, do not let them know that we are aware that this is going on and it is not acceptable, they're never going to change. They're never going to change. You see this impeachment inquiry going on right now? It's teaching politicians a lesson. Every potential presidential candidate now knows you're going to be held accountable by a system of people who are going to hold you accountable. So you can't just do what you want to do. Do you see what I'm saying? We've got to hold the medical establishment accountable. If you're going to a doctor and they're in their late 50s and 60s, that means they've been practicing medicine for close on 30 years. You know what that tells you? You know what that tells you? That tells you that they probably have an issue. They probably are not even listening. If they're not, time to change. Sit down and have a frank conversation with them, right? Have a very frank conversation with them about what it is that is on your mind. And if they're not willing to change, time's up. Time is up. My friends, the day and time for us putting up with substandard service based on our class, based on our money, based on what we look like or sound like, that day and time is over. If you are someone who came here from Eastern Europe or some other part of the world and you don't speak English in an American fashion, right? And you speak with an accent and they treat you badly wherever you go, time is up. Time is up. The implicit biases and prejudices, the first thing they think is you don't have enough sense. Some of these folks who come here from other parts of the world were doctors, lawyers, and engineers, scientists, and physicists before they came here. And you're going to treat them just because they transferred from a whole other country and now they come here, you're going to treat them like they're substandard and subhuman. This is why people resent the implication. They resent when you put people in a box and call people immigrant, because it sounds like they're uneducated, they're unsophisticated, and they're nobody. Your damn jackass ancestors were immigrants at one point. Do you see what I'm saying? And these are the implicit, and people don't even realize what they're saying. When you do that and you say, well, this is my friend. Yeah, but you're still making derogatory comments about their personhood. I can't begin to tell you as an ethnic person how many times that has happened to me. And I speak, according to them, the standard is to speak English. I speak the Queen's English. You can't even speak English the way that I speak it. But here you are making derogatory comments about my personhood. And you have never walked the ways that I have walked. Do you see what I'm saying? Somebody is making a comment here. Yeah. No, you can talk back to me. I want to hear what you have to say, right? But do you see what I'm saying? So this is why you find then when you go into the medical scenarios and medical environments, you literally have to stand in your personhood and make sure they recognize that you're a person and you are here because you need a service and it is their responsibility. No, you're not intruding. Join in the conversation. You're not intruding at all. Come on, right? You're welcome to join. This is an open forum, right? But do you see what I'm saying? You have to let them know that I'm a person. I'm here for service. And then they're going to adjust. I look like a human being, don't I? Yeah. Right? Yes, you can follow me. Right? I look like a human being. I sound like a human being. Right? So I deserve to be treated with the courtesy that comes with that. I kid you not. These things happen. We have so absorbed these implicit biases, we don't even realize how they translate. And if you don't believe me, you need to go into medical environments. Most of the doctors you see are brown with names that have like 20 syllables, right? And even with them, right? You're welcome. And even with them, they too have implicit biases. They too treat Black people as if they don't matter. What is it that's happening? They're absorbing the attitudes from the establishment. And if you were to have this frank conversation with them, then you would wonder, because and the question I ask is where you come from. You have a caste system where you can't touch certain people based on your caste system. Well, baby, that doesn't happen here. So get with it. You can either go back home and do that, but don't do it here. And here you have a series of recording. You know, there are ways in which you can elocute and demonstrate your dissatisfaction with it. Most of us don't stop to take the time out to do that. So it continues and continues. Do you know it's affecting you? It affects you. Listen to what you say about those experiences. That's how you know it affects you. So you have to deal with it. You have to go back to it and say, this is not acceptable for me. I do not like being treated like that. You need to understand that I'm a person and I'm dissatisfied. So give me the names of the people whom you relate you who supervise you so I can let them know. And see how quickly people change. I'm a person. Treat me with respect. Right? And this is why I tell you all, make sure that you have a patient advocate. You all have that. You all have someone who is your patient advocate. Go to your doctor and ask for it. It's called a durable power of attorney for healthcare. Go get it done. It means in today's world, everything is synchronized, right? So they have access to your chart across multiple platforms, multiple healthcare platforms, which is good. So if you go to another city or something, or you go to another hospital and something happens, they're able to access your chart so they can see your durable power of attorney for healthcare. It appoints someone to make decisions for you in the event that you're incapacitated. I tell folks all the time, don't go to the doctor alone, especially if you're anticipating there's going to be a pronouncement of a life sentence. Don't go alone. Make sure you go with someone whom you have empowered to ask questions on your behalf. And you tell that person, I can't talk, so you make sure you can talk for me, right? You're a dentist from Bangalore, India. No, can I ask you something? Are you living in the United States? Are you practicing as a dentist? I need you to tell me that because I want to know. I want to know what your experience has been. People come, people are people are people, and it's time out for us to understand that. Nope, there you go. So you're not practicing as a dentist. What do you do here? Tell us. Because people think when I talk like this, they think I'm, making stuff up, as if I don't hear this from real people and I don't experience this or have been exposed to it. You see where I'm coming from? Right? So tell me what you do. You don't practice. You're a dentist from India, but you don't practice as a dentist here. I am just saying, right? So you're planning to go to the UK where you will find more acceptance because, yeah, I see that. I see that. I've heard that. A lot of people have gone to the UK, or sometimes they lived in the UK prior to living in the United States. I see. Right? But do you see what I mean? There's so many implicit biases. There are implicit biases and inherent prejudices within the system that prevents the people from understanding and accepting you. I call them the gatekeepers. One of these days I'm going to talk about these gatekeepers, right? They're the people who, when you call to make an appointment, they ask for your demographic information, your date of birth, name, social security number. They can tell where you are, who you are, right? And then when you show up, the way they treat you, they seem to be more accepting and friendlier and more open to people who look like them than they are to you. These are the things that we have to talk about because it affects the kind of care that you're going to receive if you become incapacitated and have to be laid up in a hospital bed somewhere. This is why I tell folks, don't live alone. Have some folk around you. Don't isolate yourself, right? Make sure you have people who love you enough and who are going to want the best for you when you can't do anything for yourself. That's why I tell people all the time, but it sucks to be me. Nobody listens, right? Everybody thinks, I'm young, I'm 50, I'm 55, I'm 60, I'm going to live forever. Right? No one lives forever. And we know that because the people who lived a long time ago are not here anymore. So that's enough to say that no one lives forever. Right? Let me hear what my friend from Bangalore says. You seem to be a kind human being. I try. Right? But do you see what I'm saying? And that's all we're saying is just try to be human. Even in other fields, in other forums that we go into, people, just be human. You see a human being walking through the door, be human. My daughter was in a restaurant yesterday and a homeless person walked in, and they offered him food, but he didn't want food. He was telling them what he wanted. He wanted money. So he's not about to get any kind of empathy. But people walk in, sometimes you don't even know. Yesterday we were, where were we? We were on the road somewhere. Do you know what the temperature was? My friends, it was 22 degrees. We saw a homeless lady. She has everything on her. She has, you know how that is. They probably have on like 3 different coats. She had on everything on her and was pushing a cart, standing at the bus stop. All she's really doing is riding the bus to get some warmth until, thank you, until she can get to the shelter. Because you know how shelters work. They can't get into the shelter, I think, in winter, they can't get into shelters before 5 p.m., but they have to be out by 7 a.m. And during summer, it's an extent. It's seven. During summer, it's 7 p.m. So during the day, where do they go? You and I have heated offices to go work in. You and I have heated spaces to go occupy. Where do they go? Nowhere, as it turns out. Nowhere. They walk the streets and they're homeless. Are they a human being? Yes. Yesterday, I was driving past somewhere, and I know it never occurred to me that the people whom I see under the bridge, it never occurred to me that it's winter. I don't know what I was thinking. And I saw the little encampment. And I said to myself, wait. I looked at the thermostat in the car. It's 22 degrees. And I said, wait a minute. Don't tell me somebody's actually laid out under that bridge in this cold in 22. Because I remember when I was walking to the car, how I felt. A little empathy goes a long way. People are still people. We've become a society, as humans. We've become a society more interested in making money than we are in being human. Consequently, we're ignoring people. No matter what we see people come in, people of color, and immediately we buy into the biases and stereotypes that exist instead of treating people as if they're people. People are people, and they're deserving of the common dignity of being human. Let me ask you this. If you were to one day get up and find yourself suddenly, and you ended up being in a hospital, and you don't look like how you look like this, how would you want to be treated? Right? A society. Thank you, Tony. Right? Thank you. Right? How do you want to be treated? If you couldn't talk, or somebody needs to talk for you, but your clothes look tattered because you were robbed or you were attacked, and you end up in a hospital, how do you want them to ignore you when you're trying to tell them that something is wrong with you? Would you want them to ignore you? We need to be empathetic. Empathy means putting on what? Putting yourself in someone's shoe and walking around with it. So I said to all of you folks who see Black women walk into your surgery centers, staffed invariably by white women, and the history of racial bias and prejudice is still there, and a Black woman walks in, no matter how much money she has, no matter what she drives, she walks in, and immediately, just because she's Black, you're going to mistreat her, and you're not going to listen to her when she says, I have a pre-existing condition called a pulmonary embolism. You know what that means? That means she can have what? Blood clots. What happened to Serena Williams? She had blood clots. She's an athlete. She tends to have blood clots in her legs. What do blood clots do? They travel all the way up to the lung, and that's when it becomes an pulmonary embolism. She almost died because the medical professionals, the nurses, did not listen to her when she told them. The nurse dismissed what she said and did not pass it on to the doctors. Now, she never said what happened to those medical professionals. I imagine they still don't have a job, because I would have made such a big deal about it. Her family were just really happy, thank you, that she made it. But if it were me, that would not be the end of it. I remember about 5 years ago, prior to my mother's death, and I end on this. My mother had gone to the hospital for a biopsy. This was in 2014. She needed a biopsy to determine where the cancer had been located and spread, right? And after the biopsy was minor surgery, it was no big deal, right? So mom was sent home within a couple of days for I will, right? Mom was sent home within a couple of days to for just to go back to the hospital. Well, she started to feel bad. God bless you too. Right? She started to feel bad. And then we noticed she developed a fever. The first thing I said, "Oh my God, you probably have an infection." Right? So we took her back to the hospital. I wasn't comfortable. She's mom worked in a hospital. She was a nursing assistant. So she knows. She says this feels like an infection, but she didn't want to get the folks whom she worked with in trouble. Me, I don't care. I went back to the hospital. The hospital was trying to cover up what they had done. You know what happened? When they stitched her back after the biopsy, they hadn't cleaned the area, so it created what is called a staph infection, which is common in hospitals, which meant that in 24 hours, she had become bloated and was in such pain. In 24 hours, she would have passed. You should have heard me. I threatened them that I was going to call the local news media to tell them how disgusting they were. They fixed her. They took her back into surgery and they fixed it. Hello, somebody. I kid you not. This happened, right? This happened. So I should remember there's a dentist who cares for me in Bangalore, India. Yes, I will, right? This happened. I was there. Tony, I was there. I had to talk up. After that, mom was like, if she doesn't say it, I ain't doing it. I kid you not. You gotta have someone who's a patient advocate. Don't go to the doctor alone. If you know there's something wrong, make sure you have a series of questions to ask and go with someone. Appoint someone as your backup. Appoint someone who is empowered to make decisions for you and to ask questions. And don't hide it from your family members. Let them know, because perception is everything. When mom was going for the first surgery, they told us we were gathered waiting for her. So they said, "Are you her family?" Yes. And they said, "Well, we've prepped her for surgery. Do you want to see her one last time before she goes under?" And I'm like, "Yep." And when we went in, mom was laying there with about 5 other people, and everybody was just kind of like, nobody was saying anything. And I'm like, so I looked at her and I said, "Hello, this is my mother. She is about to have surgery. Who is in charge here to come and attend to her? Because she looks like she needs some help that I can't give her." Within, just by saying that, the entire surgical unit surrounded her and said, "It's okay. Don't worry about it. You can go back outside. We have your mother. She'll be out in just a few hours. She'll be out in 5 hours. The doctor will come and give you updates. She'll be fine." And mom did this before she went under. And I was like, I can't believe it. So afterwards, I asked mom, I said, what was that all about? Mom said the perception is that if you go to the hospital and you don't have family who care about you, then they treat you like you're nothing. So she said, you got to have family who are involved. I've never forgotten that. So make sure that in your process, you have someone who is on your team, who is on your side, and who's going to make sure that you receive the kind of care that you need, right? One of my viewers is saying something. Just to look at their profession, I have to care their lives are more important. Absolutely. Absolutely. And part of it is that when the profession of medicine was established, the way they, you know, taught them, they're gods. Most doctors have a godlike complex, right? They feel like they're God. They're like, after all, life and death is in my hands every day. And I'm like, Negro person, you look like someone. I'm like, you are a sad replica of a human being, because you're just a human being who one day will be done on it. I'll tell you a funny story and I'm done. A few years ago, a guy I know is a cardiologist, and he's a cardiologist, but he was overweight. And the joke was among his friends was that, how are you a cardiologist, but you're overweight? He said he liked food. how he coped with what he saw was he ate, and he liked to eat. Well, check this out. So one night he was at one of these hospitals around here, and he was on his way home, and he made it home, and then he told his wife, call the ambulance. When the ambulance comes, tell them so and so, and tell them to call ahead that Dr. So and so is on his way. The same hospital that he just left his patients at, he ended up being a patient. He had a heart attack himself, and he was giving the EMT instructions on what to do to prolong his life on his way back to the same hospital that he had just left. A little bit of humbling. Afterwards, when we asked him how he felt, he said, totally human and humbled. I was a doctor and they cut me down to my skivvies. I was naked, laid out on the table, and I had just left there. And I'm like, wow, how humanizing that is. Fancy that. You got treated like a human. Right? And so I gotta go. And so these are the considerations that all of us need to employ in order to prolong our health and to ensure that we continue to be healthy. Right? I thank you so much for listening. You have been a great audience this morning. Thank you. And I ask you, if you're a medical professional, please be empathetic to all of us. But especially for those of us who are not medical professionals, I suggest that you educate yourself, become more knowledgeable, and ask questions. And if you're not satisfied, you need to speak up. And don't say, well, if I speak up, they're going to treat me bad the next time. Go somewhere else. Right? That's what I've had to do. I'm like, if I'm not going to get the service I need, then I'm going to leave, because this is not acceptable for me as a human being. Right? Humanize yourself. Right? Humanize yourself. All right. Thanks so much, everybody. It's Friday. Have a great weekend. Be safe, because these roads, it's full on winter in fall. Winter doesn't officially start until December 21st, but you never know around here. Right? Thanks so much. And do me a favor, everybody. Go they are reminding me to say this. Go to my website, theexodusfoundation.com, and make a donation so that we can continue to be on the air. Thank you so much. TheExodusFoundation.com. You will know it's me because we'll have my picture. I look like me. I look like me, right? Thanks, Tony. Thanks, everybody. Thank you. Thank you. Thank you. Be blessed. See you on Monday. Right. Thanks so much. Bye. Thank you, everybody. Thank you so much. Thanks, Tony. See ya. Right? We have Sunday morning coming up. Thanks so much. Bye. College football.